Okay, this is my video for the pain assignment that's due on Monday, Module 2. So for the patient, we have, Asha, who is just sustained a grade 2 hamstring sprain during their sprint workout. So initially, like how this injury occurs, her workout of 8 200-meter reps, essentially it's a lot of load over a short amount of time. And for whatever reason, whether it's just a strength deficit or something else, her hamstrings just couldn't take the load and essentially just failed under the load. So that caused her grade 2 hamstring strain. So the chemical mediators involved there's a bunch of them, but two of the big ones are going to be norepinephrine and then histamine. And essentially what these do is that they regulate the inflammatory process that is sent to this region. So they basically just tell the body to kick on and start sending nutrients, leukocytes, all that stuff to the injury site to help begin the healing process. So as for the hemodynamic changes, those happen almost instantly. So the first one, first off, hemodynamic changes are just changes to the size of blood vessels. So the first thing that happens is there's immediate vasoconstriction so that the body can prevent any rapid blood loss, because the body doesn't know if you just strained your hamstring or if you were just had a deep laceration. It doesn't know. So it's trying to prevent you from essentially bleeding out. A few minutes after that happens, your body's going to go into vasodilation, and that's to help your body essentially begin the healing process. So it essentially allows it to swell, sending the chemical mediators, anything, leukocytes, anything that it needs to get there to start the healing process. That vasodilation is going to help that get there as soon as it can. The metabolic changes, essentially your metabolism increases, especially just in your individual cells. So because of the increased need to actually heal the damaged tissue, you're going to need more energy in the body to essentially allow that to happen. A lot of the times your cells are going to switch from, originally your cells are working as aerobic. Sometimes during this injury process, they will switch to an anaerobic energy form. So, and if they don't get the nutrients they need because of that lack of oxygen, that can cause secondary cell death, which is, the secondary injury that can happen after the initial injury. So, and then if this cell death occurs, what that can do is just restart the inflammation phase. Because you already have one inflammation phase, these cells are now dying because they're essentially underfed. Now your body also has to deal with that inflammation that it's going to respond to. So the swelling process, basically all that is just extra fluids, nutrients, chemical mediators that are just going into that region to first kickstart the healing process and to also remove any of that damaged tissue that's going to be in there. That also goes straight up into the cleanup phase. So that swelling also brings in a lot of leukocytes or white blood cells into that region. And essentially what those do is that their job is to remove any dead and damaged tissue out of that region. Unfortunately, those white blood cells don't know the difference between healthy tissue and damaged tissue. So they can end up taking a lot more healthy tissue than they need to, and that can also restart the inflammatory phase, which again causes secondary cell death. Moving on to pain transmission. So in this athlete's case, her pain is going to start immediately with her injury, right? So she's going to damage that hamstring muscle, and essentially the nociceptors in that region are going to send pain signals straight up to the brain on the first order neuron to that dorsal root of the spine. Right. From there, it goes on the second order neurons to the brain, so up the spinal cord to the thalamus of the brain. From there, it's going to go on the third order neuron to the sensory homunculus. I think I pronounced that right. So also on the pain transmission, I also want to talk about the gate control theory. So it is essentially just a theory of how pain works, right? So same athlete, injury happens, she hurts her hamstring. I can't talk. A substance called A delta is sent to what's called T cells, which are essentially like I think of it as we talked about in class, kind of like a bar, right? Like a bouncer, like a door of a bar, right? Only one thing can get through it at once. Right now, the only thing trying to get in is A delta. So what that does is A delta is then sent to the brain, more specifically the sensory cortex region of the brain, which then triggers the release of enkephalin, which then is put back to the T cells. What enkephalin essentially is just a pain blocker. So think of it as, in this example, a bouncer or just someone who stops people from getting into something. So back to the original part of her injury, when she hurts herself, your body is still going to be sending other sensations to the brain. So if she hurts her hamstring and say she starts to rub it because it hurts, or she grabs it, that's going to give a non-painful stimulus that's also coming from the same region. So what that's going to do is going to send what's called A beta to these T cells. And basically now these two things have to line up and go one at a time. So A delta, A beta, A delta, A beta. That's going to diminish how much pain she's actually in. And then if we go back with the enkephalin, with the bouncer, what that does is that blocks A delta from going through the T cells. It doesn't prevent it entirely, but it definitely diminishes how much gets through, especially at one time. So what that means is that there's more A beta going through back to the brain, which is then going to reduce her pain response and just reduce how much pain she's in. Yeah, there we go.